diabetes is the single most risk factor, the biggest risk factor. So regular health checkup, even if you are diabetic, even if you are a non-diabetic, screening yourself regularly for diabetes is very important. If you are a diabetic, go ahead and take good care of your diabetes. You should avoid visiting sites with excessive dust, meaning construction sites, excavation sites, and if the visit is unavoidable, wear a suitable N95. Use sterile clean water for humidifiers and oxygen concentrators. In today's date and time, we have a lot of people who are using humidifiers at home, not only for COVID, but a lot of other diseases. Patients with interstitial lung disease, pulmonary tuberculosis, they need this sort of palliative therapy. So it is very important that we use clean, sterile water. One more piece of advice for all patients who are discharged post-COVID. Do not consider blocked nose or sinusitis very trivial, especially in context of immunosuppression, because it might be COVID. So if you have a blocked nose, don't ignore, immediately consult your physician, trust your physician, and go ahead for the tests or go ahead for the consultation and just rule out whatever could be. Best preventive measure is environmental modification, that is reduce the risk of exposure to spores in the air. So if you have a high risk group or where you are treating high risk patients, that this ward or this floor or this this room will have patients who are suffering, who are post transplant, who are post bone marrow transplant, solid organ transplant, who are suffering from hematological malignancies, you could consider the use of HEPA filtered air homes. Preventing the accumulation of dust in the environment of houses of neutropenic patients or any immunocompromised patients. We should consider that flowers and plants should be excluded from such environments. There is a myth that mucorales or mucormycosis is the black fungi. It is not. Black fungi is totally a different category of fungus which have melatonin in the cell wall. All these fungi, Aspergillus, mucor, they are hyaline fungi. So please don't call them black fungi. Medical nomenclature is very well defined for all the fungi. Mucormycosis is not contagious. A person who has mucormycosis cannot spread it to the other person. No antifungal prophylaxis. So don't ask your clinician that, I've got COVID now, should I start taking some antifungal so that I don't develop mucormycosis? So there is no prophylaxis recommended. Mainly it is all about prevention as much as you can.